One of the things that I have learnt over the last few years from my contact with many other victims of medical error is that insensitive, defensive, neglectful, or no responses from the health service when something has gone wrong is commonplace. And it does create further mental and emotional trauma to patients and their families. You need to know that when something goes wrong, however bad you may be feeling about yourself, however bad your pride has been dented, you have to put those feelings aside and consider the needs of the patient first. You have to leave your professional egos at home. Now, I can tell you, if I had been head of the hospital that was in charge of my care and the mistakes were done, on the day that the HICWA report came out, I would have either phoned or I would have written to Rebecca O'Malley, and I would have said, we welcome this report, we are fully behind it, we can give you 150% reassurance that we will work as quickly and efficiently as possible to implement these 15 recommendations, and you, Rebecca, are welcome to come into our hospital anytime you like to make sure that we have done that. But they didn't. To me, that would have been treating me with dignity and respect and common courtesy. And I suspect if there had been a greater culture of patient engagement and involvement at those hospitals, maybe that would have happened. So patients often need to be invited to speak up. For too long, it's appeared that the health services are there to serve those working in them rather than their patients. And patients were traditionally not encouraged to speak freely, let alone challenge the world of senior medics. I was very interested to hear about an initiative, and possibly you've heard about it, that sought to help facilitate patient communications with those looking after them by getting doctors and nurses to wear a bright yellow badge that says, it's okay to ask. And it was very effective. It gives permission to the patient. It's okay to take my time, and I will explain to you if you want to ask me a question. Invite patients and their families to be part of their own care team. There are studies to show that patients who take part in decisions about their healthcare have better outcomes, and they also play an important part in reducing the number of errors that occur. And if you're not doing it already, why not also ask patients to contribute their own progress notes to their medical records?